Hello everyone and welcome back to Speak Healthy. In today's video, we are going to address the diabetic drug, Metformin. Although it is widely controversial in the diabetic community, we will discuss its benefits as well as ways on how to avoid its well-known side effects. If it's your first time here, please be sure to subscribe to our channel for more videos on how to improve your overall health and well-being. Metformin is a cornerstone in the management of type 2 diabetes, having been widely used for decades due to its effectiveness in lowering blood glucose levels. Despite its benefits, it remains one of the most controversial drugs in diabetes treatment due to its range of side effects and the recent recalls that have raised safety concerns. This video explores the pharmacological effects of Metformin, its role in diabetes and cancer prevention, its side effects and viable alternatives. The pharmacological effects of Metformin. Metformin's primary pharmacological action is to lower high blood sugar levels. It achieves this by improving insulin resistance, primarily in the liver, where excessive glucose production can significantly elevate blood sugar levels. Metformin increases glucose uptake in muscles and decreases the absorption of sugar from the intestines, collectively contributing to improved insulin sensitivity. The drug works by activating AMP-activated protein kinase, AMPK, an enzyme that plays a critical role in cellular energy homeostasis. AMPK activation leads to the inhibition of mTOR, mechanistic target of rapamycin, a protein that is essential for cell growth and proliferation. This inhibition is crucial in preventing uncontrolled cell growth, a hallmark of cancer. By targeting glucose metabolism, a central aspect of cancer cell energy production, Metformin exerts potential anti-cancer effects. Studies have shown that Metformin can enhance the efficacy of various anti-cancer treatments, including chemotherapy, radiotherapy, and immunotherapy, making it a versatile drug in oncology. Metformin and cancer prevention. The link between diabetes and an increased risk of various cancers has been well documented. Hyperinsulinemia, a common feature in type 2 diabetes, is believed to promote tumor growth. Metformin, by reducing insulin levels and improving insulin sensitivity, may lower the risk of cancer development. Research since 2005 has suggested that Metformin helps diabetics avoid cancer by affecting multiple molecular pathways involved in cancer progression. Clinical studies have shown that Metformin can make CD8 T lymphocytes, which are crucial for cellular immunity against tumors, more effective. These cells can become exhausted in chronic diseases, including cancer, but Metformin has been shown to rejuvenate them in laboratory settings. This effect has been observed in various cancers, including leukemia, melanoma, renal cell carcinoma, non-small cell lung carcinoma, gastrointestinal cancers, and breast cancers. Side effects of Metformin. Despite its benefits, Metformin is associated with a range of side effects that make it controversial. Up to 90% of users report gastrointestinal issues such as diarrhea, excessive gas, bloating, and burping. These side effects, while common, are often manageable. More rare side effects include chest pain, liver failure, and a less commonly recognized side effect, vitamin B12 deficiency. Long-term use of Metformin can interfere with B12 absorption, leading to potential neuropathy, a condition already common in diabetes. Cardiovascular side effects such as palpitations, chest pain, and flushing, as well as respiratory issues like shortness of breath, have also been reported. General symptoms like fatigue, muscle pain, and weakness can occur, although patients might not always attribute these to Metformin. Dermatological side effects include skin eruptions and rashes. Neurological side effects such as dizziness and headaches are also possible. To mitigate gastrointestinal side effects, it is recommended to start Metformin at a low dose, starting at 500 mg with meals, especially dinner, and gradually increase the dose. This approach helps the body adjust to the medication and reduces the likelihood of severe side effects. Monitoring B12 levels annually can help prevent deficiency-related complications. Recent Metformin recalls. The recent recalls of metformin have added to its controversy. These recalls are typically due to contamination issues or concerns about excessive levels of certain impurities. It is important to note that not all metformin products are affected, and recalls are usually limited to specific batches from certain manufacturers. Pharmacies typically notify patients if their medication is part of a recall. Alternatives to metformin. For patients who cannot tolerate metformin or those concerned about its side effects and recalls, several alternatives are available. These include lifestyle changes, extended-release metformin, berberine, and other pharmaceutical options. Lifestyle changes. Lifestyle modifications are the simplest and often the most effective strategy for managing diabetes, especially in its early stages. Reducing calorie and carbohydrate intake can significantly impact blood glucose levels. Excess fat in the liver and pancreas can impair the pancreas's ability to produce insulin, exacerbating diabetes. By restricting calories and carbs, patients can reduce fat deposits in these organs, improve their function, and achieve better glucose control. Regular physical activity also enhances insulin sensitivity and aids in weight management. Extended-release metformin. Extended-release metformin is designed to be more tolerable than the standard form. It releases the drug slowly over time, which can reduce gastrointestinal side effects. While not a guaranteed solution for everyone, many patients find metformin easier to tolerate. Berberine. Berberine is a natural compound that has gained popularity as an alternative to metformin. It is derived from several plants and has been used in traditional medicine for centuries. Berberine activates AMPK, much like metformin, and improves insulin sensitivity. Studies have shown that berberine can effectively lower blood sugar levels and improve cholesterol profiles. It also promotes a healthy gut microbiome, which is beneficial for overall metabolic health. Berberine is less likely to cause gastrointestinal distress compared to metformin. Dehydroberberine. Dehydroberberine is a more absorbable form of berberine, offering enhanced bioavailability and fewer side effects. It retains the beneficial effects of berberine on glucose metabolism and insulin sensitivity, but is easier for the body to utilize. This makes it a promising option for patients looking for natural diabetes management strategies. Other pharmaceutical options. Several other drugs can be considered as alternatives to metformin, although their mechanisms and side effects differ. Sulfonylureas, such as glyburide and glipizide, stimulate the pancreas to produce more insulin. However, they are associated with a higher risk of hypoglycemia, low blood sugar, and weight gain. Thiazolidinediones, like pioglitazone, improve insulin sensitivity but can cause weight gain, water retention, and have potential risks for heart failure and bone fractures. Metformin and kidney health. A common concern among patients is whether metformin causes kidney damage. While metformin does not directly harm the kidneys, it can lead to lactic acidosis if the kidneys are not functioning properly. Lactic acidosis is a rare but serious condition that occurs when lactic acid builds up in the blood faster than it can be removed. It can be life-threatening, but it is extremely rare. To prevent this risk, metformin dosages are often reduced or stopped as kidney function declines. Metformin remains a vital drug in the management of type 2 diabetes, with extensive research supporting its benefits in glucose control and potential cancer prevention. However, its range of side effects and recent recalls make it a controversial choice for some patients. Alternatives such as lifestyle changes, extended-release formulations, and natural compounds like berberine offer promising options for those who cannot tolerate metformin. Understanding these options and the mechanisms behind them empowers patients and healthcare providers to make informed decisions in diabetes management. As with any medication, the choice to use metformin or an alternative should be personalized, taking into account the patient's medical history, tolerance, and preferences. Continuous monitoring and adjustment along with lifestyle interventions remain key to achieving optimal diabetes control, and overall health. Thank you again for tuning in with us at Speak Healthy. We hope you've learned a lot from today's content and are overall better for it. Please don't forget to like this video and subscribe to our channel for more content. See you next time.